do when life throws you obstacles that seem insurmountable, leading you to question every step you've taken and every dream you've chased? Welcome to another episode of LifeJacked, the Resilience Podcast. I'm your host, Dr. Rowe, and we'll be diving deep into resilience, innovation, and transformation. My next guest, John Graham Harper, knows this journey all too well. From dreams of athletic glory to facing profound health challenges, John's story is a testament to the power of perseverance and innovation. As the founder and CEO of LumaFlex, John has revolutionized recovery through groundbreaking red light therapy, turning his personal battles into a beacon of hope and healing for others. Listen closely as we explore how John harnessed his setbacks to craft a life-changing solution that's impacting people worldwide.
Sometimes life gives us lemons. Sometimes it gives us lemonade. Other times it gives us something entirely out of left field that makes us say, WTF. But no matter what obstacles come, there is most often a way out on the other side, and we are once again victorious. My name is Dr. Rowe, and you are listening to my podcast about resilience. Every guest shares a tragedy to triumph story to give listeners like you the inspiration to push through every single day. Listen now as my next guest shares how they were LifeJacked.
Hi, John. Welcome. Thank you so much for being a guest on my show. How are you?
Very good. Thank you so much for that wonderful introduction. Yeah, I greatly appreciate the opportunity to be obviously on your platform. You've built this platform. You've got a lot of trust with your audience. Everyone listens. They love what you say. They trust the information that you give out. And for me to be able to have access to that audience, I'm very appreciative. Thank you so much. Yeah, I mean, I love sharing not only my story, but obviously what light is, how powerful light is, and how it can help us in many aspects of our life. So yeah, again, thank you so much, Dr. Rowe.
Yes. No, do you know what really makes this show great, and the reason why I do it week after week is because I have fantastic people like you from all walks of life who come on and share their stories and stories of resilience, right? And not every story is, an extremely tragic story, right?
Mm-hmm.
And that, still exhibits what resilience is. Sometimes they're temporary setbacks, but it's still inconvenient, right? Your life is still jacked for whatever reason.
That's
but
right.
You can still show the listeners that, you can still bounce back no matter what the setback is. And that's really what fuels me to continue to have this show, because I can, show and prove to people that you really can get over anything and get past it.
Yeah, and I mean, even it's not just about getting past it. It's something that is written in our DNA. Like the way that we level up as human beings is by overcoming challenges. And when you look at all of these people that are very successful in whatever aspect of success or whatever definition people give, like, whether they be a famous athlete or some, the Elon, flying rockets to Mars or, or whoever or whichever, how they've hacked life is they've embraced challenges. They've embraced these times when everything really turns terrible, and they realize that they level up when they overcome it. So they kind of go forward, and they actually look for challenges because they know when they overcome them, they go to another level. And when I, cracked this code, I realize it's a blessing when things go wrong, when challenges come your way and you really are at the bottom, because that's when you can level up and you can go to heights that you haven't been before.
No, absolutely. Now, John, many may not know this, but you started out with an athletic career that unfortunately was cut short. So can you take us back to the beginning of your own journey?
Yeah, I was I was a young, skinny boy that wanted confidence, wanted attention, wanted sort of validation, respect. So I found that confidence in the gym, building muscle. I think when you talk to most large, bodybuilders or athletes, they all have that similar background where they wanted confidence, and muscle is kind of like armor that you put on your body to protect that little teddy bear inside you, you could say.
Definitely.
Yeah, I was exactly the same. And I kind of, as I was, excelling in the gym, becoming very athletic, I wanted to always, push the boundaries and get more confidence, more attention, and be able to really validate myself and my place on this planet. So that led into, to sports. And I played rugby quite well, but I had to stop playing rugby after an injury where I busted both my shoulders and my left knee. It was quite something that I'll never forget. I was on tour. I was with the whole team, and when this happens and you're rushed to hospital and the whole team it's something that sticks in your head, right? Because I remember that day very well, and I thought I was on top of the world. But yeah, obviously the universe wanted to teach me otherwise. But I, rushing through because it's a very long story, I'll try to rush through it a bit. I went into amateur boxing because I found, even though combat in sports in general it's not considered safe. In my opinion, it was much safer than rugby, where you can get a hit or a collision if you're not looking. Whereas with combat, your opponent is in front of you, and you sort of, there's a way in which you can, at least I could get this very aggressive challenge met, but I could see my opponent and I could face him head on. Nothing was coming from the sides like it was in rugby. But after years of boxing, I started to get very severe headaches, and it was like somebody was pointing their finger in the back of my head. It was like they were pushing into my skull, really intense headaches. And I went to the hospital, and after doing a series of scans, they found a tumor in my head, which the doctor told me was from microtraumas to the brain. So I wasn't allowed to do any more impact sports, and I had to schedule this surgery. I had to have this surgery in 11 months, or else the tumor would have grown, and using surgery wouldn't have been an option. So the way they did is they went into my ear to avoid any severe scarring or anything. They used this microsurgery to go through my ear and get the tumor out, and it was about the size of my thumb. But it was a very scary experience. It was something that my wife I'm very happy that she was with me the entire time. We were sort of, it was something that brought us very close together. But that basically ended any of my impact sport career. I pretty much didn't want to. Yeah, I wasn't motivated to do anything aggressive after that for a long time. But
I bet.
Yeah, it was a light at the end of the tunnel, and light being red light, because my wife, throughout my time with all these injuries being an athlete, she would always push red light therapy onto me. And it was something that I thought, my wife is Chinese, so that it was sort of this feng shui medicine. I just did it to appease her. But it worked, and I would find not only relief, but I would find complete healing. But the device that she would make me use was quite cumbersome. It was something that was difficult to use as an athlete, right? It was a lamp with a large weighted base, and I would have to drag this thing around the house. But it did work. But it got me thinking about what light was, and I went down the rabbit hole, learned a bunch of amazing scientific studies, and that's when I started my the company that I have now, which is LumaFlex, which is the world's #1 portable red light therapy panel, because it's waterproof, it's durable, it's something that you can use all in one, put on your head, your shoulder, your knee, your ankle. So even though, looking back at that time, and I was devastated, I remember being in this hospital and just thinking, how the hell did I get here? Who wants to be in a hospital with this bandage on your head?
Hey, no, for sure. So I want to just kind of, just the one thing that is so inspiring about your story for me as I was doing research and preparing for this interview is that your journey from facing a brain tumor, which is devastating within itself, right? And like you said, it was just this traumatic experience, even through the surgery, finding out how large the tumor was. but you didn't give up, right? Because you could have easily been like, you know what, I can't do anything else that's, aggressive as far as sports and athleticism that I have. I'm just going to just sit at home and just maybe collect disability or something. But that's not what you did. You decided to found a whole company, right? You founded LumaFlex, which, like you said, is a wonderful company bringing red light therapy to, people's homes. And yes, light is one of those elements in our fantastic universe, and also has healing properties, right? Because a lot of times people say, hey, you got to get some vitamin D from the sun, but not knowing that also there's this red light. So what was, you kind of already shared a little bit about, your driving vision, but really let the listeners understand, like, what was the driving vision behind developing a revolutionary red light therapy device?
Yeah, I mean, from a perspective of a competitive athlete, I was always about, what's the latest and greatest supplement, protocol, or what's this, it was all down to like the hacks that you can do to optimize your performance. And it was always pills and potions and needles and things of this sort. And you get down, you sort of go down so far down that dark path, and you certainly don't become any more healthier, right? Because there's ways in which you can optimize your performance, but they're not usually natural, and they certainly don't, support you in the long run. So, seeing something that's natural, that's from the sun, it's non-invasive, that has the ability to also not only recover, help you recover and help you heal, but also optimize you for performance, was so exciting for me. It was so I felt like, it was almost like a cheat code. It was something that anybody could, why didn't anybody tell me about this? Why have I been spending all this money, on these very invasive artificial ways of boosting my performance and recovery, when there's natural means readily available, right? So what's outside in sunlight? You got about 54, 55% of sunlight is infrared light. That's what we can't see. Around 40% is visible light. And then that remaining amount is UV light. So a lot of people, when you think about the sun, you think of UV light. You think about the sunburn, right? Or which catabolizes our cells. But we don't ever really think about red and infrared light, which actually gives our cells energy. And the optimal time to get red and infrared light, when it's pure red and infrared light, is at sunrise and sunset. And that's, me being based here in Miami, there's beautiful sunrises, Thailand, or, any in those areas. If you've ever been to Bali, there's beautiful sunrises and sunsets there. That's red and infrared light. And the later UV light that comes into play later in the, throughout the day, through the middle of the day. But what does this light do, right? The light gives our cells energy. So it goes through our skin and gives energy to the mitochondria. The mitochondria is the engine of the cell, we all know, right? So giving energy to the engine of the cell allows the cell to do what it's supposed to do. So it's not really the light that is healing you or optimizing you. It's giving energy to your cells for them to heal you and optimize you. And when this was explained to me, from a scientist who I'm still very, very close friends with, those 6-7 years ago, I was blown away. It was something, I almost fell off my chair. I thought it was so amazing how something that is readily available to us outside at any, it's always available to us throughout the day. But we do want that pure red and infrared light. So creating devices, beds, panels, portable devices like mine, we're getting those powerful rays of light that provide those healing. We're putting them into a product, into a device, and you can carry it around with you. You can aim it at the area that you need, cellular energy. And to me, it's magical. It's something that I'm, every day wakes me up out of bed with a big smile on my face because it's so exciting.
I love it. So with red light therapy, and with LumaFlex, explain to the listeners exactly what is red light therapy, how do you use it with the device, and what are the true benefits, like all the benefits? You've named a few of them, and of course we can use it in rehabilitation, but what are the true benefits of using the red light therapy?
So with LumaFlex, we are using, for red light, we use 630 nanometers. We use this particular nanometer for red light. That goes about an inch into the body. And then we use 850, which is for infrared. That's infrared light. That's the infrared nanometer that we use. So those 2 nanometers are programmed into the LED, and each LED is both red and infrared. So it's a dual nanometer LED. So on the panel, I have 45 LEDs. That's 45 red and 45 infrared on the panel. So going about an inch into the body, we can service conditions on a surface level, like me being an amateur boxer, getting bruised in the face. This was something that that you can use for skin rejuvenation, right? Now, infrared is going deeper into the body. That's addressing, chronic pain, like bone, down to the bone, into the joints, pain that is, plagued people for a number of years, and but then their cells don't have enough energy to address that pain. So now, by giving energy to the cells in that affected area, the cells now have a surplus of energy which they can use to heal. That's how it works. So remember, anything to do with light is cellular energy. It's cellular health. Anything, whether it be an LED mask, or a large panel device, a bed, an infrared sauna, or any sort of portable device that's addressing pain. It's giving energy to the cell. It's making your cells healthy. It's allowing your cells to do what they're supposed to do. So 3 mechanisms occur by giving energy to the mitochondria, to the cell, right? We got increased ATP, we have increased blood circulation, and we have anti-inflammation. With these 3 mechanisms, there is an array of outcomes that you can attain, and that can be even, hair growth. There are devices now that you put on your head to support hair growth. The LED masks I mentioned for a beauty outcome, for addressing wrinkles, pimples, right? Or allowing your skin to be rejuvenated and making you look younger. I mean, the whole longevity, living longer with Brian Johnson, how he's this guy, he raves about how he wants to live forever. He uses red light just for, addressing his cellular energy, giving his cells energy. So always remember that whenever there's a question about what is light, always think it's giving our cells energy. It's addressing the condition on a cellular level. It's like imagine you had your phone. You got your iPhone, and your iPhone is losing battery, and you're trying to, use it. You're trying to use Uber. You're trying to play some phone game, or you're using the chat feature or social media, and the battery is draining on your phone. When you plug the battery, when you plug the phone in with the wire, that's the same as what light is doing to your body. So a lot of questions people ask. It's like, can it do this, or can it do this, or can it do this? In my mind, it's like people asking me, can I use this application with that much battery? Can I use this application with it? Forget all of that. You're putting, just like you're plugging your phone into the wire, your body is getting energy on a cellular level. So anything that the cell needs to do or to be optimized to do, that's what light can give you, right? It can give you that energy.
Yes. Oh my goodness. So, one of the things that I know about innovation, because this is definitely innovative, right? Most times innovation, it stems from personal challenges, which you have personally, right? You are through recovery and through, in going through rehabilitation. So what do you think fuels your desire to do this research to help others? Because, you can have a product, right? And you can develop a product, but if you don't really do the research, because I can tell that you really have done the research on red light therapy, like you know it through and through. So what do you think drives this desire to do this research?
From my competitive background as an athlete, you don't just want to make something that is the same as everybody else's, or do something that is the same as everybody else. You want to, it's something, I'm not to be boastful or proud, but if you're going to do something, just be the best at it, or at least try to be the best at it. Like LumaFlex, for design and innovation, I've won 8 global awards on this product. It's the most heavily awarded product in red light therapy on the planet now. And I think people have asked me, like, how did you sort of, in manufacturing and building the product, prototyping, testing, all of this, it all just came from like, well, if we're going to, this idea, if we're going to do it, you might as well be the best. Like if you're going to compete, don't shoot for like second, third place, go for the first place. I think that's kind of where it came from, at least from, in my head, where I get the drive from. It's kind of just, I like in our, for example, running, user trials in the early prototyping phase, right? That development phase where we're trying to get a product and we're passing it out to people and getting feedback. So I wanted a product that encourages consistency of use, right? This is what's very, very important. I don't want to innovate on light therapy or on portable devices. I didn't want to innovate there. I wanted to innovate on time. I wanted to innovate on people's time and people using the product. The product needed to adapt to the person, not the person adapt to the product. Because if you have a product that adapts into people's lives, then they're easy to use it. It's comfortable. It's seamless. Then you create consistency. And that consistency is where red light therapy really is a game changer. Somebody who is consistent in using red light therapy on a day-to-day basis, if they have a condition, they run in, they have a car accident, or they're all beaten up and bruised, or they have an injury, they will recover much faster than if someone who had that same incident just starts using red light therapy. So consistency is something we always see in success. If you want to lose weight, you want to be a millionaire, there's things that you have to do every single day. And red light therapy is no different. So, coming from a fitness background where I'm encouraging people to be healthy, to exercise every day, 10 minutes every day is better than, twice a week, for an hour. You're preaching this consistency message. I applied all of that into the design, and the development phase of how we brought the product out. And I'm very happy where it came from. I obviously, there's obviously trials along the way. There's failures along the way. So when I look back, I don't have this thinking of like, I planned for all of it to go this way, and that's where I am right now. I planned, to be, the world leader in portable red light therapy. It happens along the way. It just sort of goes, and you just have to be open. You have to be, accept those challenges, those pitfalls, those times when you stumble, and, make sure that you learn from it and keep going.
One of the things that you mentioned consistency earlier, and I know one thing that has definitely been consistent for you in your life is having a strong support system. And I believe that having a support system is crucial in resilience, right? Can you kind of talk about the key people in your life who've helped you push through and how they've influenced LumaFlex's journey?
Definitely my wife. Definitely my wife. But that saying, behind every great man is a great woman. I like in my professional career when I'm shaking hands with some of these, the who's, whether they be like a famous athlete or, a famous, person, like even, the famous biohacker. Like I had the wonderful opportunity to meet RFK at the inauguration on the 20th in D.C. It was, it was part of the MAHA movement, right? This Make America Healthy Again. And his wife was there as well. I see it all the time. I see the wife being a great support to help, to grow people's careers, a lot of these careers that I know of these gentlemen that I know. And my wife was exactly the same. My wife, all the way to the, from the beginning, whether it be like going through the surgery, lots of failures and mishaps, lots of business failures, she was always there. Never sort of, someone that was never questioning or just sort of, she was very, rolling with the punches and just saying, look, this is something that, it's hard now, but it's going to get better later. My wife absolutely, like 100% has been my rock. Other than that has been my older brother. Big shout out to my older brother. He's he's my oldest brother. He's been a great support. Obviously my mom, my dad, and then obviously people that I find, like especially in manufacturing and light therapy manufacturing, there are some gentlemen that are really good at what they do, and there was one guy in particular, Alan Derkisher, who's very, very exceptional at what he does with light therapy, much more learned in light therapy than me, but really wanted me to learn and grow as well. I got a lot of encouragement from empowering me, and that's something I'll never forget. But yeah, I mean, the list goes on. There's so many people. You can't do it alone. You really can't.
No, absolutely. And I know one of the things about resilience is that it's built through mindset shifts, right? And especially as a business owner, right? As an entrepreneur, you're an entrepreneur, I'm an entrepreneur. There are peaks and valleys, ups and downs, ebbs and flows. So how do you maintain a positive and forward-thinking outlook whenever you're faced with big challenges? Because, of course, challenges do come, right? Especially personally, but most definitely professionally. So how do you stay positive even when, maybe an order doesn't, go out on time, or a product, you use the manufacturer and there's some defects that are discovered, which all of those things, like, you can't even anticipate you anticipate that they may happen, but you can't control whether they happen or not, or just any other random things, right, that happen when, as an entrepreneur in your business. So how do you stay positive?
Yeah, that's such a great question. It's something that I'm still learning, and I don't think I'll ever know how to completely, do that or completely hack that part of my life. Because there's this balance between discipline and motivation. Your motivation and discipline, you need to keep them both in check. You have to have discipline to get the work done, but motivation kind of gives you drive to do it. And sometimes, with big motivation, can also have like a very big crash. So I'm always learning, to have, my discipline take over when my motivation fails, when things are rough, when the storm hits the company and we're all, it's like there's that feeling like abandoned ship. That's when you have to have that discipline and be like, no, just do the work. And I think everyone who does any kind of fitness, who is, they get up and they go for a run, or they go to the gym, or they're just used to the gym, before, when it was as a competitive athlete, I used the gym to excel in a sport. The gym was a place in which I was, working on myself to compete somewhere. But now the gym is a place of like peace. It's it's where I fix my problems. If things are going really bad, like those problems that you mentioned, exactly. This happens all the time. It's so funny you said that. I think you must have a little bit of a background in manufacturing, because that happens all the time.
Yeah.
And when I run to the gym, that's the place where I've conquered before. Like, I own that space. So then that gives you this confidence to then fix a problem outside where, you're having trouble. So definitely a regime, that discipline, a routine is really important. It's so fundamentally important, because the company now is growing at a very fast pace, and there's those growing pains where we have to do the refining, the back end work. We have to make sure we're crossing all our T's and dotting all our I's. There's all those little things that need to be done, because we're moving so fast. So it's something I'm having to get used to right now. Very good.
I love it, though. The key thing I think that you said is, in building resilience, especially professionally and personally, is keeping that motivation and discipline in sync, right? It's so hard because it's easy at times to just give up. It's so easy, right? And a lot of times it almost feels like your brain wants you to give up, right? Because I feel like your brain is like, let's just not do this because it's safer than what you're trying to do, right?
Yes.
But I think it's the discipline that, if people can develop discipline, I think that's what helps us to go, nope, I'm going to see this through. I'm going to make this commitment, and I'm going to finish it. I'm going to get to the finish line, which, that's very much what athletes do, right? We got to finish it. We got to get to the end.
That's right.
That's for sure it.
100.
It's almost over, but I do have one last question for you. And it's for our listeners hoping to cultivate resilience in their own lives, whether it's an athlete who is, in recovery, or if it's an entrepreneur just trying to make it day to day, developing their company. But what practical steps or mindset shifts, if you will, like you said, with the motivation and discipline, would you recommend based on your experiences?
I'm not really a fancy person with my morning routines and my, 40 books this year that I've crushed and all, my podcast. I'm kind of a real meat and potatoes kind of guy, but I'm usually what I would always just, something that really resonated with me as a young kid, which I always think about, is I remember hearing a quote. There were two quotes that I just always seem to have in my head. One was, do something that scares you every day, right? And for me, that was like just embracing challenge, understanding that overcoming challenge is how you reach another level. So do something that scares you every day. And then the second is forward, always forward. And I think there was some Marine who said this, and it's just something that it seems simple, but sometimes simple is what works, at least in my head as an athlete. I'm not like the sharpest tool in the shed, but I just know what it means to work, to overcome challenges and not be scared of when things go wrong, to realize that it's just it's a down, and then what's coming is now a very, very big up. So, sometimes that's the best I got. If you want to hear like some real magical guru stuff, that's, I'll save that for the Tony Robbins and all those guys. They've got better advice than that.
Hey, no, but you know what I love about each guest and, people such as yourselves, you're authentic, right? Because sometimes it is something very simple. It's not something that's deeply profound. It's something that we all have at our fingertips that we can just grab and hold on to and apply to our lives. That's really what it is. It's really what it is. Well, thank you, John, for sharing your extraordinary journey with the listeners and me today. Your story, turning personal adversity into innovation, is a powerful reminder of what resilience truly means. I mean, you've shown us that the profound impact that a change in perspective can have on our lives and those around us. So how can listeners find and connect with you?
Where I'm very much active is on Instagram at John Graham Fitness. So that's a lot of chats. We have a lot of great ambassadors, influencers, athletes that endorse LumaFlex. So they usually comms are always on Instagram. And for email, just John@LumaFlex. Anybody who wants to really understand what light therapy is, right? We have an education program. We have the LumaFlex Academy. We have the Foundations course. This course, in my opinion, is the most well-packaged course on the planet that allows someone to go from zero to hero in light therapy and integrating light therapy into their lives. Anybody listening, if you email me, just say, I listen to the podcast, I want to enroll, I'll enroll you for free. We sell it on the website, but if you're listening, email me at john@lumaflex.com and give me your email and I'll enroll you for free. I just need to get the education out. It's the way I see the whole, photobiomodulation industry as a whole growing, and more awareness coming to natural and non-invasive means of treatment over using pharmaceuticals. So yeah, it's something I really encourage everybody to jump on, join our education.
Wonderful. Any last words of encouragement for the listeners?
Yeah, I mean, if you're hit with a challenge, just remember that this is like a gift. It sounds really hard to think that, but once you hack that, once you learn how to hack embracing challenges, that's when you kind of go to God mode. Yeah, that's when you activate God mode. So embrace challenge, the way forward.
Love it. Now, John, as we conclude this episode of LifeJacked, the Resilience Podcast, I hope the listeners feel inspired by your journey and motivated to transform their own challenges into opportunities for growth. And listeners out there, don't forget to contact John so that you can be part of the Red Light Therapy program. I want to wish you and your family, John, nothing but blessings and abundance here in 2025. Please take care.
Thank you so much.
John Graham Harper, everyone. Be sure to join me next time for more uplifting stories and insights on resilience. Until then, keep pushing forward, embrace the journey, and remember that every setback can lead to a greater comeback. Dr. Rowe, signing off.